Well, hello there. My name's Skip McCoy. Welcome to an introduction to RiverSoft Mobile. RiverSoft Mobile is a small app specifically designed for home care nurses and therapists to document the care on their patients. They do this by logging into the app with the username and password assigned to them by their agency. Once they log in, they're going to get their patient list. Their patient list is the list of patients they've ever been scheduled to see who are active, hold, or incomplete. The patient list is sortable by name, status, whether or not I have in-use notes or incomplete notes for that patient, if there's mobile-grams, by case manager. And these yellow lines indicate that there's an in-use note. That means I've got an incomplete note for that patient. It's calling my attention to these patients I have to do work on. If I click on one of the patient lines, the patient buttons become enabled, and I can get to the clinical notes, which is what I mainly do. I can get directly to the care plans. I can do a case analysis on the patient, look at a face sheet, medication profile. I can look at the patient schedule and her travel location because the office system pays me before I travel, and I can maintain my own schedule. But first I want to show you how fast and easy it is to put in a visit note. So I'm going to go to clinical notes. These are all the clinical notes for this patient, and I'm currently working on a visit note. This is what a clinical note looks like in RiverSoft Office. This top part is the header. It has the demographics for the patient and the legal and DNR information, as well as the primary and secondary physician. And then this is the body of the note. The body of the note contains body systems. For a start of care note, this would have a lot of pages on it. Assessment items and post-assessment items. Each one of these little buttons represents a page of data. So the way you'd fill out a note is you work from top to bottom, left to right. I'm going to go into the body diagram. I already completed some things on a wound here. I took a picture of the wound so that the doctor can log into RiverSoft Mobile and see how the wound's doing. And I'm just going to work through this note from top to bottom, left to right. If the page is blue, it means nothing is required on that page. If it's yellow, it means I have to go into that page and at least click something. And I'm not going to do a Braden scale on this visit. No case supervision on this visit. Depression, I'm not doing depression screening today. Homebound status is not changed. Hospital risk A, nothing's changed here. Nutrition, again, nothing's changed. Pain, that patient has no pain. Vaccination status, no updates here. Visit aid, I didn't do any supervising of an aid. Vital signs. I'm going to pretend like I took the patient's temperature. And nothing else. Clinical summary. The interventions, this is really the heart of the electronic medical record. There are 15 total interventions and 12 are ongoing. And I'm going to use the voice-to-text feature here. Instruct the patient. I instructed the patient to try to have a better positive attitude. Okay, medication review. Just going to pull up the patient's medication profile. I'll just say I've reviewed everything. And then I'll do my time slip. I was here from 5:45 p.m. to 6:30. This is where I sign, and this is where the patient signs. And I'm done. That's how fast and easy it is to put in a visit note. Of course, I can document all I want, and I can make it take longer, or I can make it take less time. When I complete the note, it's going to do a note analysis and look for incomplete items or inconsistent items. And as long as I don't get any red warnings on my analysis, and there's nothing red on there, my note is completed. And this one went right to locked. It went right to locked because it has no verbal order information on it, and I'm not under clinical review. So instead of the office actually reviewing this note, it's going to go right to payroll and billing. Start of care assessments, and actually any assessment or any note with the verbal order, are always reviewed first. Okay, well, that's how you put in a note in RiverSoft Mobile. Besides that, I can go right to a patient's care plans and verbal orders if I wanted to look up some history. This is they only have one care plan, and these are all the verbal orders on top of that care plan. I can get a face sheet on this patient, and a face sheet is everything the agency knows about this patient from intake onward. And nice thing about tablets is you can size these documents big and small just by collapsing your fingers, pinching, collapsing your fingers. Demographics, the complete doctor order history, payer insurance authorizations. That's my face sheet. Med profile, it's right here. All the medication administration is done within the note, so that's completely electronic. The patient schedule, and that's in a tabular format as well as calendar format. Travel items, that's if I need to go to the pharmacy and I need to get paid for my travel time between this patient's home and the pharmacy. And then self-scheduling. I can control my own schedule with RiverSoft Mobile. These are my visits over the next 2 weeks, and if I need to move a visit around, I just simply highlight that visit, and I can change the date and the time right there. If there are open visits in the office that match my skill, I can take that open visit and it will become part of my schedule. This is my current schedule in calendar format and tabular. I can get to old patient information, discharge patients if I want to do case analysis on those patients. And then this I button is training for RiverSoft Mobile. It's both in text and videos like the one you're watching. That's basically RiverSoft Mobile. I enjoyed showing it to you. You can see how simple it is. All the training is done online. It's self-trained through videos. Hope you enjoyed the presentation.